A tooth extraction is the permanent removal of a tooth from its socket and may be done manually using forceps or surgically. Extraction is recommended when the tooth cannot be saved with any other treatments, such as root canal treatment, and to prevent infection from spreading to other areas of your mouth. It may also be performed to extract extra teeth. Indications: your dentist may recommend pulling a tooth if there is severe tooth decay that affects the underlying nerve, an infected tooth that does not respond to antibiotics or root canal therapy, improperly positioned or overcrowding of teeth, tooth trauma causing irreparable damage, problematic wisdom teeth, and if gum disease is present and causing loss of bone and tissue supporting the tooth. Preparing for a tooth extraction. Your dentist will review your dental and medical history prior to the procedure. Please inform your dentist about any medical conditions, allergies, and any medications you are taking. Antibiotics may be prescribed before the extraction to prevent infection. Procedure. Extraction is usually performed under local anesthesia. Your dentist will numb the area around the tooth to be extracted to prevent you from feeling pain. Forceps are then used to grip your tooth and move it back and forth until it is freed from its bony socket and attaching ligaments. If the tooth is impacted, the overlying bone and gum may have to be removed in order to release it. Once the tooth is extracted, blood fills the socket and forms a clot. Your dentist will place a gauze pack over the socket and have you bite down on it to compress the wound and stop bleeding. A few stitches may be placed over the extraction site to close the wound. After a tooth extraction, you will typically go home after extraction and need a few days to recover. You must keep the gauze pack in place for 3 to 4 hours, but may replace it with fresh gauze if it gets too bloody. Your dentist will prescribe pain medications for your comfort. Pain and swelling can also be controlled by placing an ice pack over the area. You should avoid vigorous rinsing or spitting or the use of straws, as these activities can dislodge the blood clot and cause bleeding. Brush your teeth as normal, but do not brush or floss at the extraction site. Avoid smoking, as it can delay healing. Warm saltwater rinses are advised after 24 hours. A soft diet is recommended until healing has occurred. Risks and complications. For proper healing, the blood clot should remain intact. Sometimes it breaks loose, exposing the underlying bone. This can result in a dry socket, a painful condition. Vigorous rinsing or smoking after a tooth extraction can lead to a dry socket. To treat a dry socket, your doctor will place a sedative dressing over the wound until a new clot is formed. Once your tooth is removed, there's an imbalance of forces which can result in the shifting of surrounding teeth. Your doctor will recommend a replacement tooth or other treatment to restore balance and improve dental function. Call your dentist if you experience prolonged bleeding or pain, excessive discharge from the site, fever or chills, chest pain, cough, or shortness of breath. Summary. Extraction is usually performed to remove a potential source of infection and relieve pain which is difficult to treat otherwise. A week or two after the procedure, new bone and gum tissue